welcome back to my channel. Please excuse the fact that I look disgusting right now. I've just woken up and I need to have a shower, but I wanted to start this vlog nice and early. Today I'm going to be taking you guys with me to my GP placement. You may have seen my last vlog in which I was going to my obs and gynae induction, and I'm actually so surprised at how quickly those 4 weeks went. I'm already in my second week of GP right now. So today I just wanted to do a vlog to show you exactly what it is that a fourth year medical student does at their GP placement. I'm placed at a lovely practice in Bolton. It takes me about half an hour on the motorway to get there, so I need to really hurry up, quickly have a shower, quickly have breakfast, sort my face out, and then leave. I'm ready to leave now, but I haven't left myself enough time to eat anything, which is not an unusual occurrence, so I am now going to take this protein bar and just eat it in the car for breakfast. This is one of our waiting rooms. It's currently empty. We have some small chairs here for the little kiddies. This is my room for today. And this is where I'm going to do my consultations. Just sat down now on my desk and I'm just going to log into the computer, log into the system. I've already been told by the doctor as soon as I walked in that there are a couple of patients that he wants me to ring. So I'm just going to get started and then keep you updated. So I've just finished speaking to my first patient and I have a bit of a gap before I need to call the second patient, so I'll just tell you a little bit about how it works here. So at the moment, all patients are getting a telephone consultation before they're asked to come in. So when we take a history on the telephone, we'll just decide whether or not we think we need to see this patient. So what happens is, before I come in, the doctors have already made a list of patients that they want me to see. I obviously don't see as many patients as the real doctors do. I see 3 in the morning and then 3 in the afternoon, which should only take a real doctor 1 hour for 6-10 minute consultations, but it takes me all day. So basically I have a list of patients that I need to call and I've seen the first one already. I call the patient and then I take a history and then I decide whether or not I think this patient needs to be seen. I update their notes on the electronic system that we have and type in all of the information that I've got from the patient, and then I send a message via the electronic system to the doctor that's supervising me, and in that message I'll just tell them to have a look at the notes that I've written up, and I also tell them what I think is going on, what I think needs to be prescribed to this patient, or what I think the diagnosis is, and then the doctor will just have a look at the notes from their end, from their office, and then he will either give me the heads up to ring the patient back and tell them they need to come in for a face-to-face appointment, or he'll tell me yes, that diagnosis is correct, and he'll just prescribe the medication from his end, because obviously I can't prescribe as a student. So if I say to the doctor that I think this patient needs to be examined and needs to be brought in face-to-face, they'll have a look at the notes that I've written and send me a message back and say, yes, Hiba, that's fine, just give the patient patient a ring and tell them to come in for say 2 o'clock or 3 o'clock. So that's how it works as a student. You can't make any final decisions, but you're doing most of the work on your own, so it's really cool. You do feel like an actual doctor working here, whereas in hospital sometimes you can feel like a bit of a spare part because there are just so many people and you're not really needed as much. But here, of course, you're taking care of the patient yourself. Even if the doctor makes a decision to prescribe a medication or bring them in or whatever they want to do or refer them on, you're the one that has to call the patient back and complete the whole consultation. If the patients come in to be examined, then obviously I have to examine the patient under the supervision of the doctor. It also really helps being at a nice GP practice. The practice that I'm at is so nice. Everyone here is so friendly. Every morning before I start, the doctor just says, here's your list of patients, but don't worry, just grab yourself a cup of coffee, make yourself a cup of tea before you start. So even though there can be a lot of patients to see in one day, it still feels quite chilled. When patients book an appointment through reception, usually the receptionist will ask what the reason is for booking the appointment. So as the doctor or medical student, when we're looking on the system, we can see what the complaint of the patient is. So this next patient that I'm going to be ringing is a child with an earache. Knowing that is obviously really helpful for me as a student because I can kind of think of the questions that I would like to ask this patient just to make sure that I don't actually blank out on the phone. Because this child is quite young, it's actually their parent that I'm going to be doing the consultation with. And depending on what it sounds like when I've spoken to them, I'll decide whether or not to invite the child in to have an ear examination. So like I mentioned earlier, I obviously don't want to go blank when I'm on the phone to the patient and not know what to ask next. So when I know what the patient's coming in with and I know what they're complaining of, before I call them, I just quickly grab my iPad and I just write down in my notes all of the things that I think I need to ask them, just to make sure I'm getting in all of the important questions and so I have something to look back on if I can't think of what to ask next. So for example here, I've written it's ear pain, so any pain, you're going to start off with Socrates. If you don't know what Socrates is, it stands for site of the pain, onset, so when it started, character, what type of pain is it, radiation, whether it radiates from anywhere or it's just in one place, associated symptoms, T is for timing, does it come and go, is it constant, E is for exacerbating and relieving factors, whether the patient has tried anything already for the pain, and then S is for severity. And I've also just written down I want to ask about injury, for example, using cotton buds, any fever, discharge, changes in hearing, headache, dizziness, rash, facial weakness, tinnitus, sore throat, adynophagia. Adynophagia is pain on swallowing, night sweats or weight loss, and obviously all the rest of the history, so the past medical history, surgical history, drug history, allergies, family and social history. Obviously the stuff that I write on my iPad is not all I'm going to ask. Depending on my clinical judgment, depending on how the conversation is going and what the patient says, there are obviously going to be additional questions to ask according to what direction the conversation goes in, but this is just so I have something to look back on to make sure that I'm getting all of the important questions in. So now I'm going to call the patient and see what's going on. It is a child with an earache, could be a potential infection, so I do think it's highly likely I'm going to have to ask them to come in so we can have a look at the child's ears, but obviously we'll see how it goes. I have now just finished speaking to the child's parent who had the earache, and it does sound like an ear infection. It sounds like it's otitis externa. I've typed up all of the patient's notes on their record and updated that, so I've written all of the details of the history that I've taken. I personally did think that we need to bring this patient in to examine their ears, so I did tell them on the phone that it's likely that you're going to have to bring your child in, and would you be available if we ask you to come in today? So after typing the notes, I sent a message to my supervising doctor just asking him to read over the notes, telling him that I think the patient needs to come in for an examination and asking him what he thinks, and he's just confirmed that yes, we do need to call the patient in and that the diagnosis that I think is probably the most likely. So now I'm just going to ring the patient back and then ask them to come in for 1 o'clock when I'm going to examine them. Whilst waiting for the child with the earache to come in, I've spoken to 2 more patients that I had to see this morning. So I looked at the first patient's past medical history and their notes, and from the notes I could see that they had a long-standing history of back pain. So like I went through earlier, I just got my iPad and quickly wrote down all of the things that I want to make sure to ask this patient. I wrote down all the back pain red flags, which are symptoms that if a patient's having them, it means it could be something quite serious. But when I actually called the patient and spoke to them, it turned out all they wanted was a fit note, which is is just a sick note or a doctor's note to give to your employer to tell them that you're not fit for work right now. That's happened to me a couple of times where you think your consultation is going to be about a certain thing and the receptionist may have written a certain note that this patient is coming in with back pain, but actually the consultation ends up being about something completely different. So I just got the doctor to give a fit note. The second patient was a patient with chest pain and the history sounded a lot like a chest infection. So we've invited them in and I'm going to examine them as well in the afternoon. I finished writing all of the notes up for all of the patients. When I examine them, I'm going to also update the examination findings onto the system as well. So we have a record of everything that happened in this consultation. The GP that I am with has just asked me if I'd like to go on a home visit with him before my patients come in to examine. Home visits are reserved for patients who aren't able to get into the surgery, so they're usually older patients. So I said yes, I'd go with him just because I really like going on home visits. I think it's really interesting and there's a lot to learn. So I'm now going to go on the home visit and then come back and do my afternoon consultations. Back from the home visit, myself and the doctor that I went with have just stopped at Morrison's to pick up some lunch. I have just picked up a chicken sub roll, a smoothie and a yogurt bowl. I have just come back to my room with my lunch, so now I'm just going to sit down and eat my lunch because I'm really hungry. As you might remember, I didn't have breakfast properly either. So I finished my lunch a while ago and I've just finished examining the two patients that came in to be examined. I did otoscopy on the child and the patient that sounded like they had a chest infection, the chest was actually clear on examination. My hair looks horrible right now. We also have these little stickers that we can give to children when they come in for an examination. They're really cute, they just say well done. I still have 3 appointments to do on the telephone for this afternoon and I'll let you know how it goes. So the next patient that I've spoken to is someone who has really bad knee pain. So they need an MRI scan and for that they need to be referred to orthopedics. So the doctors just asked me to write this patient's referral letter to the hospital. So that's what I'm going to do next. Now doctors are always running short on time, which you probably already know. So they usually use this dictator machine to kind of dictate their letters. So they just speak into it and then the letter types itself. I am actually going to type the letter out myself because I don't know how to use this software and because I have a lot more time than they do. Okay, so I've finally finished all of my appointments for today. Everyone that I've spoken to that needed to be seen has been seen. We've examined them. I completed the referral letter for the patient with the knee pain, so that's all been done as well. It is now 5:20 p.m. so even though it may look like I wasn't doing very much, it actually took quite a long time to get through all the patients. Overall, it's been a really great day. The doctor that I've been with was really happy with everything I did. I'm really enjoying working in this GP practice. All of the doctors have said that make sure you work in another one as well before you decide on doing GP because not everyone is as nice as we are over here. I have felt so much like a real doctor working here. As you've seen, I take care of the patients from start to finish. It's completely up to me to take the proper history, ask all the right questions, not miss anything out, examine them and come up with a diagnosis, and then also relay that diagnosis back to the patient, tell them what we're going to do to manage them going forwards. So it's a great experience working here and I'm really sure that my time over here is going to fly as well. I'm now going to head home. So I am pretty much home now. I've just stopped at the Lidl that is 1 minute away from my house just because I need to pick up some tortilla wraps and mayonnaise. I'm making peri chicken wraps for dinner today. I have everything else at home, that's the only thing that was missing. So I'm just going to quickly pick those up and then go home. I am back home now, as you can obviously tell. I got home a while ago around 7:15 and I just got changed straight away into my pajamas. Who else gets straight into their pajamas? Changing into my pajamas just makes all of the tiredness go away. I also just washed all of the SPF off my face and brushed my hair, even though it doesn't look like it. So now I'm just going to chill for a bit and start making dinner. I am going to end the vlog here. I hope you guys enjoyed watching it. If you guys did enjoy the vlog, please do let me know by commenting below. Honestly, I love reading your comments. It honestly makes my day when I read one of your comments. Please let me know if you like the vlog, if there's anything you want me to do differently, if you want me to do more vlogs. I hope I was able to show you and just give you a little peek into what it looks like being a fourth year medical student, being on your GP placement. Please do consider subscribing to my channel if you're not already. I make videos about being a medical student in Manchester, so if you found this one interesting, you might find my other videos interesting as well. And to be honest, if you watched this far, then you should be subscribed. Anyway guys, thank you so much for watching and I'll see you in the next video.